ADHD, attention deficit hyperactivity disorder. This is what I really wanted to learn. Okay. The core features of attention deficit hyperactivity disorder, ADHD, include persistent patterns of inattention and/or hyperactivity. The / in the name of this disorder implies that individuals can be diagnosed with primarily an attentional disorder, primarily a hyperactivity disorder, or a combination of both. As with other psychological disorders, the individual's symptoms must be severe enough that they interfere with daily functioning. For children, these symptoms can interfere with development. Although the symptoms can vary for children and adults in their specific manifestation, these disturbances remain at the core of the disorder regardless of the individual's age. The first set of criteria for ADHD is noticeable disturbances in attention, including failing to track details, being liable to make careless mistakes, having difficulty staying focused on tasks at school or play, appearing not to listen when others are speaking, failing to follow through on projects, taking disorganized approaches to tasks, being distractible, showing forgetfulness, having a tendency to lose things, and being reluctant to engage in tasks requiring sustained mental effort. The second set of ADHD criteria includes signs of hyperactivity such as fidgeting, being unable to sit in one place, showing extreme restlessness, being unable to engage in quiet activities, talking excessively, finding it difficult to wait for a turn when speaking or taking part in group activities, and interrupting while in conversation. For both these sets of criteria, individuals need to exhibit at least 6 symptoms for at least 6 months. Children who show these symptoms must do so more than would be expected for their developmental level. Furthermore, the symptoms must have a direct negative impact on the individual's life. Clinicians diagnose people with ADHD combined type who meet both sets of criteria for at least 6 months. ADHD predominantly inattentive type is diagnosed if the client meets the criteria for inattentiveness, but not hyperactivity impulsivity for the past 6 months. Finally, clinicians can diagnose clients as predominantly hyperactive impulsive if they meet the second set of criteria but have not shown inattentiveness for the previous 6 months. The fact that ADHD is considered a neurodevelopmental disorder implies that it begins early in life, if not by the age of 12. If an adult shows these symptoms, the DSM-5 authors assume the disorder happened not to be diagnosed earlier. Researchers estimate the mean prevalence of ADHD around the world at 5.29%, but prevalence rates vary widely by country and region of the world. The prevalence estimates in the United States appear to have remained stable since 2007 at approximately 5.5%. That can't be accurate because I feel like during COVID, a lot of people got diagnosed. Like, for example, I have ADHD, and prior to COVID, I got diagnosed, but I didn't want to accept it. But during COVID, I had no choice but to accept it because it was just impairing my life way too much. Okay. Turning now to understanding the clinical picture of ADHD, it is clear that children who experience this disorder can face many challenges that persist into adulthood. During the grade school years, ADHD places children at risk for receiving lower grades, as well as for showing repeated discipline problems that require placement in special education classes. Okay, they're doing the most. As children move into their adolescent years, if their ADHD is untreated, they show a wide range of behavioral, academic, and interpersonal problems that create serious difficulties for them and challenges in their relationships with family, friends, and educators. Young adults with ADHD are more likely to develop substance use disorders, including heavy drinking. They may also be more likely to develop depressive disorders. Okay. So it looks like worldwide males have a higher estimate of prevalence. Adolescents, children have a higher prevalence, and South America has the most prevalence of ADHD out of all the continents, followed by Africa, followed by North America, followed by what's categorized as worldwide, and so on. In adulthood, ADHD in adulthood compared to childhood is more likely to manifest itself as primarily difficulties in maintaining attentional focus. Those with adult ADHD are likely to have trouble organizing tasks, make careless mistakes, lose things, and perform more poorly on tasks that require them to prioritize activities on the basis of importance associated with deficits in executive functioning. The symptoms of ADHD can also lead adults with the disorder to have serious problems in relationships, whether the relationship is with an intimate partner, a coworker, an acquaintance, or even a stranger. Educators and clinicians are likely to miss a diagnosis of ADHD in girls, whose symptoms tend to be less overt than those of boys. In girls, ADHD may include symptoms such as unusual forgetfulness, disorganization, low self-esteem, and demoralization. Unlike boys, girls with ADHD tend to internalize their symptoms and show symptoms of anxiety. Similarly, women with ADHD are likely to show more subtle symptoms of the disorder than do men. Therefore, girls and women who show these symptoms of ADHD may be misdiagnosed and not receive appropriate treatment. It's so true. When I first started going, because I was like, there's something's not right. Like, I need help with. They would always be like, you have anxiety, you have depression, yeah. And I was like, no, I don't. But finally, got diagnosed correctly. Theories and treatment of ADHD. The biological determinants of ADHD have been well established by family, twin, adoption, and molecular genetic studies. Researchers estimate ADHD heritability to be as high as 0.75 to 0.90, with the larger estimate based on clinical cases. Studies of individuals with ADHD suggest defects in a large number of genes, perhaps as many as 26, including evidence based on animal models. The audacity! Researchers have also found structural brain abnormalities in people with ADHD, and they believe a network of interrelated brain areas is involved in the impairment of attentional executive functions of these individuals. As they get older, some individuals with ADHD are able to compensate for these abnormalities in engaging their frontal lobes while carrying out cognitive activities. Tying together biological abnormalities and behavioral problems in ADHD, Berkeley's theory of ADHD proposes that the core impairment is inability to inhibit responses due to abnormalities in the prefrontal cortex and the way it communicates with other parts of the brain. This impairment of response inhibition manifests itself in 4 areas of the individual's functioning: working memory, internalization of self-directed speech, self-regulation of affect, motivation, and level of arousal, and reconstitution, the ability to break down observed behaviors into component parts that can recombine into new behavior toward a goal. My God. Not them describing me completely. In addition, according to Berkeley, children with ADHD fail to develop a future orientation and sense of the self across time. Consider how each of these impairments is expressed in a child's behavior. Problems with working memory cause the child to have difficulty keeping track of time and remembering such things as deadlines and commitments. Having an impaired internalization of self-directed speech means that these children fail to keep their thoughts to themselves or engage in private self-questioning or self-guidance. Their impaired self-regulation of mood and motivation causes them to display all their emotions outwardly without censorship, while being unable to self-regulate their drive and motivation. Their impaired ability to reconstitute causes these children to be less able to solve problems, because they are unable to analyze behaviors and synthesize new behaviors. Okay, sample items from the Adult ADHD Executive Functioning Rating Scale. Each item is rated on a 1 through 4 Likert scale. 1 is rarely, 4 being very often. Self-management to time. Sample items: procrastinate or put off doing things until the last minute, late for work or scheduled appointments. Scale: self-organization and problem solving. Individuals with ADHD will often be at a loss for words when I want to explain something to others, unable to think on my feet or respond as effectively as others to unexpected events. Self-discipline. They may make impulsive comments to others, have trouble following the rules in a situation. Self-motivation. They are likely to take shortcuts in their work and not do all that they're supposed to do. Others tell them that they're lazy or unmotivated. First of all, that is so rude, because it's true that people say that kind of stuff, and it's just so rude. Anyway, self-activation/concentration. They're easily distracted by irrelevant thoughts when they must concentrate on something. They have trouble staying alert or awake in boring situations. Oh my god, I just got read to filth. Anyway, impairments in executive functioning appear to play an important role in affecting the daily lives of individuals with ADHD. Adults with ADHD-related impaired executive functioning also show impaired academic and social functioning, achieve lower occupational status, and have higher rates of criminality. Sample items from the Adult Executive Functioning Scale. I read them to you already. Although functional and structural abnormalities are found in the brains of people with ADHD, most researchers believe the disorder emerges from an interaction between genetic vulnerability and exposure to environmental stressors. These stressors include birth complications, acquired brain damage, exposure to toxic substances, infectious diseases, and even marital stress of parents. Children of parents who were diagnosed with ADHD as children also have a higher risk of developing the disorder, particularly if they live in families with lower educational and occupational attainment. Children who experienced a major trauma in their lives also have higher ADHD prevalence rates. Individuals with ADHD who are treated from the biological perspective receive medications intended to control their symptoms. Although there are more than a dozen brand names under which prescriptions are written, most medications are based on methylphenidate, Ritalin. Over the past few decades, pharmaceutical companies have made significant advances in developing effective medications for ADHD, such that more recently produced medications in extended release formulations are longer lasting. The first class of stimulant medications, which included methylphenidate, was effective for brief durations, 3 to 5 hours, and required multiple well-timed doses throughout the day. The extended release formulations work in one of two ways: via so-called backloaded delivery systems that work later in the dosage interval, and through beaded 50-50 delivery systems that divide delivery up equally early and late. One advantage of long-acting medications is that they are less likely to be abused. The individual is also less likely to forget to take the medication because there is a longer time frame between doses. Concerta, that's the one I take. Concerta is a backloaded product. 22% of the dose is in the immediate release overcoat, and 78% is delivered approximately 4 hours after ingestion. Adderall XR is a delayed release medication that mimics the effect of taking 2 equal doses. The duration of action is 7 to 9 hours in adults. As an alternative to methylphenidate, antidepressant medications are sometimes prescribed for people with ADHD. These include bupropion, aka Wellbutrin, SR, Pemoline, aka Silert, atomexetin, aka Strattera, and imipramine, aka tofranil. Clinicians use these medications to treat mild to moderate ADHD, with some effects starting to appear as soon as 2 to 3 days after beginning treatment. Clinicians typically use this group of medications for individuals with mild ADHD symptoms and coexisting symptoms such as anxiety or depression, medical conditions that contraindicate stimulant use, tic disorder or Tourette's disorder, and drug abuse histories. However, methylphenidate can be prescribed with either antidepressants or antipsychotics, given that individuals with ADHD may also have comorbidities that bring them to the attention of a psychiatrist. Y'all! There's a case study right here. I'll come back and read it later if we have time. Parents are understandably concerned about the side effects that occur with stimulant use by children requiring ADHD treatment. The side effects are so horrible. I don't wish them on anyone. However, other than slightly lower body mass to height ratios, there do not appear to be significant effects on growth during the late childhood to early teenage years. Critics contend that clinicians overprescribe stimulant medications for ADHD, using medication as the primary and often only intervention for dealing with behavior problems. Moreover, based on animal models, long-term use of stimulants such as Ritalin may have effects on cognitive functioning that could outweigh its benefits. In the non-pharmacological realm, a number of interventions are effective in reducing ADHD symptoms and helping individuals with this condition function better interpersonally and feel better about themselves. Murphy outlines a multi-pronged approach to psychosocial treatment. Although he focuses on the treatment of teens and adults with ADHD, some of the strategies would certainly be relevant for families of children with ADHD. The 8 strategies are as follows. This is fascinating. I had not heard of this. Number 1, psychoeducation, or professionally delivered treatment that integrates psychotherapeutic with educational interventions, is the starting point. Because the more people with ADHD know about their condition and how it affects them, the better they will be able to understand the impact of this disorder on their daily functioning and develop coping strategies. Psychoeducation instills hope and optimism as the individual frames the condition as treatable and begins to expect that life will become better once he or she begins making changes. It's so true. Psychological therapies, such as individual therapy, provide a context in which clinicians and their clients can set treatment goals, resolve conflicts, solve problems, manage life transitions, and treat coexisting problems such as depression and anxiety. Specific techniques, such as cognitive behavioral strategies, can help clients change maladaptive behavior and thought patterns that interfere with daily functioning. Maladaptive thought patterns have commonly become entrenched as the result of recurrent negative messages from teachers, parents, and peers. Compensatory behavioral and self-management training provides the opportunity to build skills by incorporating more structure and routine into the person's life. Simple strategies can make day-to-day tasks and responsibilities more manageable. These include making to-do lists, using appointment books, keeping notepads in useful locations, and having multiple sets of keys. Other psychological therapies, such as marital counseling, family therapy, career counseling, group therapy, and college planning, also provide opportunities to assess the various ways in which ADHD symptoms affect life choices and the people with whom the individual is involved. Number 5, coaching, a more recently developed intervention, consists of consulting with a professional who can assist the individual with ADHD to focus on the practical implementation of goals. In other words, the coach helps the person find ways to accomplish things through a pragmatic, behavioral, results-oriented approach. Technology-based computer programs can help individuals with ADHD access tools and devices that assist them to communicate more effectively, write, spell, stay organized, remember information, stay on schedule, and keep track of time. School and workplace accommodations can facilitate productivity and minimize distraction. Students and employees with ADHD usually work better in quiet, non-distracting environments. They are also more likely to succeed when they receive more frequent performance reviews to help shape their performance and establish priorities. Teachers and supervisors should restructure tasks in ways that capitalize on the person's strengths and talents. It's so true. That's why I have the divider here. And the last way to help people with ADHD that doesn't have to do with medication is advocacy, particularly in the form of advocating for oneself, is especially important in attaining success. Although it is difficult for most people to disclose the disabling aspects of ADHD to others, they may find that explaining their condition improves the situation for everyone involved. I actually, personally, anecdotally, will say that I do not think that that's true. If you work at a corporate job, I suggest you don't tell anyone about your ADHD. It's not more helpful. Me and like the people from my ADHD group, we've all had that experience. So unless there's a reason, a positive outcome, a helpful positive benefit that will come out of you telling people you have ADHD at work, don't tell them. That's my personal advice as an ADHDer. Because all this stuff, when you get diagnosed, they don't tell people you have ADHD. They don't care. They don't care because you don't look like you have a disorder. So people don't care. Okay? This multi-pronged approach is obviously most appropriate for teens and adults who can take more managerial responsibility for their lives. Clinicians, parents, and teachers treating children with ADHD can nevertheless adapt some of these strategies, which can also be combined with stimulants as part of an integrated intervention. Implicit in the behavioral approach is the notion that the family must learn to use behavioral methods and directly involve themselves in helping their children reduce disruptive behaviors. Coordinating these efforts with comparable intervention by classroom teachers improves the odds for helping the child gain better self-control.